Hello, this is Bridget Conlog, Health Sciences Librarian for Pharmacy and Nursing at Wilkes University. This is a brief tutorial about Essential Evidence Plus. Essential Evidence Plus is an evidence-based, graded resource that provides reliable summaries that incorporate the current biomedical literature, systematic reviews, clinical guidelines, and other resources to provide information to inform patient care at bedside. Essential Evidence Plus also features an alerting tool called POEMS, short for Patient-Oriented Evidence That Matters, which is designed to provide the healthcare practitioner with information about new developments in clinical practice that matter to patients. To access Essential Evidence Plus, log into the Wilkes portal and go to the Farley Library homepage. Scroll down and click on the Databases and Indexes link. Click on the E and click on Essential Evidence Plus. There are also links to Essential Evidence Plus on the Pharmacy Research Guide and also on the Nursing Research Guides. Summaries, called topics in Essential Evidence Plus, are reviewed 3 times a year. They are written by authors who are experts in their fields and are reviewed by 2 physician editors. Depending on the topic, some summaries undergo external peer review as well. Let's do a search and look at a topic. Essential Evidence Plus is composed of all the databases that are listed here. You can click on one and browse through it to find information. Each one is organized in the same way by subject matter. For example, if I click on the Guidelines database, I can see that there are any number of articles that are associated with any particular subject. You can click on those and you'll see them listed here in alphabetical order. You can also access these databases here through the drop-down menu. You can also search them singly from here, or you can search all of them simultaneously. Let's search them all at once. I'll search type 2 diabetes mellitus. And click on search. And here is the list of results. The Essential Evidence Plus topic will be here at the top of the list. Here's some other ones, so for example for type 1. And then here's the results from all the other databases. Let's open the topic. The overall bottom line section is for quick reference. Recommendations and evidence statements are each assigned a grade. If I hover over that, you can see that this particular statement was classified using the sort system for grading. You can click on the letter and that'll take you to some information about what that means. So here's the information about the sort taxonomy, and this is how they assign a letter, A being the highest quality evidence and C being the lowest. And you can see here's information about other taxonomies that they use. For example, let's look at this one by the Oxford Center for Evidence-Based Medicine. And they get quite granular here. You can see they tell you exactly what type of study is needed to assign a letter grade or a grade number and letter grade of 1A. And there are many similarities among the different taxonomies, although some of them, as you can see, this one by Oxford is quite granular. You can jump to any section of the summary by clicking on these tabs here. As a pharmacist, you might be interested in reading about treatment. Notice that this section also provides letter grades. Here, you can see them. Okay. And it also provides links to the references that were used to make that statement. So you can see that a poem was written actually for this treatment recommendation. And if you want to read the article on PubMed, look at the study yourself, there's a link out right there to PubMed. Okay, so they're organized like this. Let's see all the different therapies. Okay. You can click on tabs for specialized populations, which in this case is concerning infants and children. Up here on the right, you see different calculators that can be used for this disease state. Now let's look at a poem. As I noted earlier, you will find them referenced throughout the summaries, and you can also search for them on the home page. So let's go back there and let's click here. And I can see that they're organized by year, can go by category, can go by, again, by system. Okay. And let's go back here. If you want to search for a disease state in particular, you want to go up here. Okay, and let's do diabetes again. Click on that, click on search, and you can see that there are 236 poems written for type 2 diabetes mellitus. Okay, you can sort them A to Z, most recent. Okay. So let's go ahead and let's just open one. So, okay, all poems are based on a clinical question. They provide information about bottom line. Here's the reference. And here's some information that might be important to the practitioner, such as what type of study it was. And then here's a quick synopsis. And then there's the person responsible for writing it. If you'd like to subscribe to the Poem Alerting Service, go back to the home page and click on either of these links and just follow the instructions to set that up for yourself. And this concludes the tutorial for Essential Evidence Plus.